name is Jenna Forrest. I am a Bachelor of Science honors student in psychology, and this talk is just going to be about some of the risk factors and some of the mental health kind of programs in the community that are available for substance use disorders for youth. So, starting off, a substance use disorder can be defined as a mental disorder that affects a person's brain, their behavior, and this can lead to an inability to control the use of substances. They can be illegal or legal drugs, medication, alcohol, any kind of substance. And the symptoms of this disorder can range from moderate to severe, and addiction is kind of the most severe form. So recent research suggests that in Canada, youth that are aged 15 to 24 have the highest kind of rates of substance use disorder in Canada. And even further, they assess that males have higher rates than females in Canada. And then some little literature review on the risk factors. So this study kind of assessed parental influence of substance use disorders, and they found that exposure to parental substance use predicted adolescent substance use disorders, and this was independent of other factors such as social class, ADHD, stuff like that. So this study kind of emphasized that family environment really played a big role in kind of the development in youth substance use disorders. This study assessed kind of which substance was most prevalent in youth, and they found that alcohol was the most common form. And the results showed that community norms that were kind of favorable to substance use, family history of alcohol or substance use, siblings substance use, and kind of poor academic performance and low perceived risk of substances and peer influence kind of had a positive association with substance use in youth. And then they also found that kind of religion and social skills have negative associations with substance use. And then this one kind of just assessed that family, school, and peer influences all kind of played a role in predicting adolescent substance use, and this kind of included lack of parental supervision, minor criminal behavior. And then this one assessed the parental and peer influences. So they found that kind of too strict or too lenient parents kind of were at higher risk for their youth developing a substance use disorder. So the authors of the study kind of wanted to emphasize that an appropriate level of support and control was necessary, and it could improve parent-youth relationships, which could then improve their ability to guide their kids to engage in positive health behaviors. And then more leaning towards peer influences, adolescents who have a friend who smokes increases the odds of them smoking by 5.4 times. And then when they're actually invited by this person to smoke, the odds increase to 10.46 times. And you see the similar effects for friends that drink too. Adolescents with friends who drink increases the odds of 1.89 times, and then when invited to drink, the odds increase to 11.825 times. So we kind of see the effects of peer pressure, peer influence here. And this, again, just further supports family and peer influences. In early adolescence, parental monitoring and delinquent peer association predicted substance use, and then in later adolescence, it was family relationship quality and delinquent peer association that kind of predicted substance use. So this study suggests that parental monitoring and parent-youth relationships may play a role in the adolescent's choice in peers, which then can ultimately influence later substance use if these peers are kind of like delinquent or substance using. So this is kind of just a review, kind of like on each ecological level of risk factors. So age and sex, at the individual level is kind of like youth age 15 to 24 and male. The microsystem level is associations with substance abusing and or delinquent peers, peer pressure, parents favoring the behavior or promoting the behavior as kind of like a good thing. Parental substance use, again, just kind of like using the substances as a normal thing around their children, and or parental monitoring. The mesosystem level is kind of more like family and peer influences. So it's kind of that study that outlined the poor parent-youth relationships and poor monitoring of children kind of influencing their choice of friends. Exosystem is the community norms favoring substance abuse, and the macrosystem level is the cultural norms, and the chronosystem level is more like major life transitions like parental separation, like big moves from like your hometown to somewhere else, the death of a loved one, that kind of stuff. And these are just some of the mental health resources in the community. I think there's about 6 here. So the first one is the Breton Health and Wellness Home. This establishment offers a variety of programs, including crisis prevention and intervention, mental health and addictions services to anyone within this community. These programs encourage healthy lifestyles, and they're offered through monthly information sessions and group and one-on-one counseling. Another one is adolescent outreach services. So this establishment kind of focuses on providing brief and early interventions, screening, outreach, and community partnerships between youth ages 12 to 19. So this is kind of like the younger end of the spectrum here. Workers kind of engage with youth in a school-based setting, and they provide youth with early intervention services through group and one-on-one interventions. And they also provide contacts and referrals to anyone who may be able to help further. The Ally Center of Cape Breton is again in the community, and they provide education, support, and advocacy services for everyone in Cape Breton. They offer primary health care clinic, opioid overdose prevention training, and take-home naloxone kits. And in addition to this, to kind of emphasize the how to do this safely. If you are going to choose to do it, they provide safe injection equipment, so clean needles, alcohol swabs, filters, and ties. And they also provide sharps containers for safe disposal of used needles. And this is also known as like the same, like the sharp advice needle exchange. The Adult Addictions Day Treatment Program is at the Cape Breton Regional Hospital. It's, again, in the community. It's a 2-week program for individuals who want to make changes in their substance use. They explore topics including relapse prevention, refusal skills, how the brain is impacted by addiction, and self-care strategies, healthy leisure options, mindfulness, and coping with anxiety. And then the last 2 are here at CBU. So the Nancy Dingwall Health and Counseling Center. It's a collaborative health care center with nurses, including a mental health nurse, physicians, and counselors that offer like confidential healthcare services to all Cambridge University students, staff, faculty, anybody. Professionals work with students to deal with a variety of issues, including parenting, family conflict, and addiction, as well as so many others. And they can also put you in contact with additional people if they think that maybe someone else might be able to help you further. And then this is kind of more for like the students. There's a mental health and addictions peer support group. And this is kind of a supportive and safe space for students where they can have the opportunity to talk to others and learn from others' kind of lived experiences with mental health and addiction. This group connects students to mental health resources if needed and other communities of support other people. That's it. Thank you. Any questions?